You may have noticed that America is experiencing an epidemic of testosterone deficiency in men. Now, we can easily recognize and understand testosterone deficiency in women because it happens in menopause. It can happen before menopause, but it definitely happens in menopause. There's a sudden collapse of testosterone levels, resulting in all kinds of things like loss of energy, lack of motivation, depression, mood swings, irritability, lack of sex drive, and so much more. This is a result of the loss of eggs. When a woman runs out of eggs, she no longer makes hormones at the levels that she used to because the eggs are what made the testosterone and from it estradiol. But men don't have eggs, men have sperm, and men don't run out of sperm like women run out of eggs. So how do we explain this epidemic in men? Sadly, we see men even in their 20s who are severely deficient in testosterone. There are a number of reasons for this. Concussions can cause sufficient damage to the brain to prevent adequate signaling to the testes to make testosterone. This signaling can also be impaired by infections such as chronic viruses. I believe the number one cause of testosterone deficiency in men today is toxins. Now, you may not be aware that alcohol and tobacco are toxins that decrease testosterone production. So do opioids. So by definition, anyone taking opioids for chronic pain will be deficient in testosterone. There's no buts about it. It's going to happen. But for the larger number of American men who are deficient in testosterone, we have to place the blame squarely where it belongs, on the ever-increasing number of toxins in our environment, our food supply, our water supply, you name it. How many toxins do we put on our skin in the form of skincare products? How many toxins go in our mouths in the form of what some people call very loosely food, the additives, the preservatives, all the lovely things that are supposed to make it taste better or last longer on the shelf? Yes, they bring certain advantages, but at a huge cost. And what about all the pesticides? Isn't it ironic that we treat food with pesticides so that other things don't eat the food, but then we eat it? That's not good. And we pay the price. Yes, at Prestige Wellness Institute, we've been replacing testosterone in men for decades. But we also encourage men to undergo a formal comprehensive detoxification program for two reasons. One, once you detoxify adequately, you may not need testosterone replacement anymore. But more importantly, if toxins are impairing your production of testosterone, what else do you think they're doing? Do you think they don't affect every cell in your body? Absolutely they do. Whether you come to Prestige Wellness Institute or live too far away, be sure to get help from a doctor who understands toxicity and detoxification and can help you get your health back.